Malolo malia ho eki belelea tonga kotoa. Welcome to the Voice of South Pacific broadcast from Seattle, Washington. I'm Sylvia Fatima Aho, and thank you for joining us, with our program today. I would like to welcome our Providence Elderplace. Before we continue on, I would like to acknowledge we have a mourning and a funeral here in the Amos City. Kai ofalahi atu ki he mea whakaeke ko ia mai wao tuifua pehe whoki ki he whamiri hono kotoa. O te waki whoka e whai loto e whamiri whakaosi ko nau whapaapa mai whailonga i ai mo ui ai tamai ko i tonga ane ko i kui ki he whamiri tuifua. Pea ko ia whakahoko peheni i Seattle, Washington, tau whakahoko ahono mea whaeki ana malanga i a pongpongi ka wheka ngā mamahi atu ai polo kalama Voice of South Pacific and Radio Tonga Seattle ki a ki motolo ai whamiri. Pea ko ia te mautoi o atu pe live hanga tonu i hoko totonu ko ia ai ono ki he o wau ko ia o e ngai whai lotu mo e ofa ai whamiri whakaapa-apa ki he pekia. Ko ia o kai e whamalolangi heni ko te waki ki tau kau whatahe prokalama whawhoofa koini. O koe e whaam ke mo whamoremore ka mo wahe atu ai prokalama koe ahoni. This is with Providence Elderplace. The purpose of this program today is to educate others, about ways to save yourself, from being a diabetic person. And they will detail you all the great information that will help us all. Ko e Providence Elderplace ko nau tau mo a ke koutou reka ke mo nofo pe i api o fia pe mo uilele iai. Ko nau ngai polokalama o ku ikai ke i ai hatotongi ki ai o ka pau ko osi lava pe o hoko ko e client pe me state pe o ku lava lele e polo kalama ko toa pe o ao na mai o ave koi na provide the transportation pe a koi one stop does it all iai katoa ai katoa ke ta pe koi ai ta whawhetai ka kai tonga o kumtuku nau taim ka nau mai ke tokoni ke vahe mai ai ngai polo kalama mau engoi ni. Thank you so much, Sarah, and also Molly. I'd like to introduce you to our audience today. Thank you for joining us. And for those of you that are also watching on the Facebook live stream, you can also watch it at any time on YouTube. Even it's also on YouTube live right now, but you can always watch those both programs on Voice of South Pacific. Thank you so much. Thank you so much, Sarah and Molly. I will let you, introduce yourself and what are the great topics that you wanted to share to make a difference in other people's lives today. Thank you. Yes, Sarah, one more time because I cannot hear you. Yeah.
Okay. Can you hear me now?
Absolutely. Loud and clear.
Well, thank you. I was just saying thank you to you, Sylvia, for, first of all, such a wonderful broadcast for your community, and also for inviting us. We're so happy to be here with you, and we're going to be talking about diabetes tonight, but we're hoping that it's just a conversation and you can answer, hopefully we can answer questions that you may have. And I'm Sarah Babineau. I'm one of the doctors at Providence Elderplace. And I'm joined by...
Hi, I'm Molly. I'm one of the nurses, one of the nurse case managers at Providence Elderplace. And I was so excited to get this opportunity. I actually got to meet Sylvia very briefly in one of our clinic visits not that long ago and told her about this broadcast, and turns out it was her broadcast. So super excited to share a little bit about diabetes management and how we kind of approach that at Providence Elderplace. So thank you so much for having us.
Thank you. Anytime, and you're more than welcome. This is a great topic to share with our community because of our lifestyle. I think there's a lot of us, are affected, with the diabetic and also with the kidney failure. And I'm so glad that you can come on and share and to learn how we can try to live happily and be healthy at home. Home sweet home. Thank you so much. Okoya ko fefia mo fafi eten ki mo tol ko mo loto ke mo lava bahe atu. Nengo pe alu I helefa papalangi. Te to lava pe ki at pe mo halefa tonga mo halefa ha mo ki mo tol ko yak fanong mai ahoni, and you can always share it. Thank you. Go ahead, Sarah or Molly, whoever wanted to go and start. So we have a great topic today. It's about like diabetes, and they can talk a lot more, to show us, how to live a healthy lifestyle. Thank you.
Thank you. We do have some slides. I don't know if you want me to put up, I can share my screen or how it would work. Just a few slides as a guideline for our talk tonight.
Okay, I'm gonna ask Netta. Netta, which one that will work better for them? Okay, you can go ahead and share the screen from there too.
Okay. Oh, I guess, are you able to let me share my screen? Sorry for the technological difficulties. Okay, thank you.
Share by me, Henny, so that the people can actually see it. Netta.
No, she needs to share it so it's big enough for this. So I think you're able to share now.
Oh yeah. Let's see if this works. Can everyone see the screen, or can you see it, Sylvia?
Yes, yeah. Okay. Very nice.
So we're just gonna go over just kind of a broad overview about diabetes and how we approach it at Providence Elderplace. I'm sure those of you who are living with diabetes have lots of wisdom to share about what works for you and what hasn't worked for you. And we're happy, like I said, to answer any questions you might have as the evening progresses. But I just wanted to give a little bit of a broad overview about diabetes. And some of this probably you already know. But as you probably know, your body does need glucose, the other name is blood sugar, to work normally. And glucose gets into the cells to kind of fuel the cells with the help of a hormone called insulin. And so there are a couple of types of diabetes. One type is when people don't respond to their body's insulin, and that's type 2 diabetes, and that's pretty common. Type 1 diabetes is when people don't produce insulin, and those type 1 diabetics often have to be on insulin. Type 2 diabetics don't always need insulin. They can sometimes be managed with medications. So when there's not enough insulin, or if your body doesn't respond to insulin, then blood sugar builds up in the blood. And what happens is that that blood sugar affects the inside layer of your blood vessels, and that causes kind of a narrowing of the blood flow and the narrowing of the blood vessels. And this is a little picture. You can kind of see what happens with time and high blood sugars. So it does impact your whole body, because as you imagine, blood flow is very important to a lot of our major organs. That includes your eyes and your kidneys and your heart and your limbs. So we'll talk a little bit about the things that we worry about with diabetes, but also about how you can advocate for yourself and how we can try to keep you healthy. I know Sylvia said we want to, keep you healthy at home, and that's our main goal at Providence Elderplace, is to keep you as healthy as possible and as independent as possible. So the heart is a very important organ, as you all know, and diabetes can cause atherosclerosis. That's a fancy name for just a decrease in blood flow to your heart muscle. And so this puts folks with diabetes at higher risk of things like heart attacks, chest pain from poor blood flow, and stroke. Diabetes also affects your feet. So if you don't have good blood flow to your feet, it can lead to foot ulcers, and it can cause the damage to the nerves that carry sensation in your feet. And you can also get infections, which are harder to heal if you don't get good blood flow to your feet. So I would imagine that some of you have experienced that, and that's why we think it's very important to pay attention to your toes and your feet when you see your medical providers. Diabetes can also affect your nerves. So this can cause kind of a burning sensation in your legs and feet, as well as sometimes in your hands, which can be really uncomfortable. It can also cause problems in your digestive system. So some people have something called gastroparesis, where they don't kind of absorb nutrients well, or they have chronic nausea from their intestines not moving as well because of their diabetes. And then, of course, diabetes can affect your eyes. So the most common condition that we worry about with folks with diabetes is called diabetic retinopathy. It's a fancy name, but basically diabetes can impact the small blood vessels and nerves in your eyes and make it harder to see. And especially if you're hoping to stay independent, vision is a very important part of that. So we do like to make sure we're checking your eyes regularly if you have diabetes. You can also have glaucoma, which is the fancy name for high pressure in the eyes, and cataracts, which is clouding of the lens of the eye. And then, as it sounds like from Sylvia, some of you know diabetes can affect your kidneys. And the kidneys are really important organs that filter waste from your blood. And damage to this filtering system can lead to kidney disease and sometimes kidney failure when you need to have dialysis to help filter the toxins from your blood. So we did get a little question from Sylvia ahead of time about just thinking about what are signs of high blood sugar in folks. And the most common signs are frequent urination, having to go to the bathroom often, being very thirsty. Some people can lose weight because of this. Some people feel tired or have an increased appetite. People with diabetes can also have low blood sugars, and that sometimes happens if we give too much medication or if you're sick and you don't eat as well as you usually do. And these are some common signs of low blood sugar, which is feeling shaky or confused or nervous. Some people feel kind of clammy or sweaty, fast heartbeat, feeling lightheaded or dizzy, and feeling sleepy or weak. So as a medical provider, and especially Nurse Molly will talk about this, we do like to have people learn how to check their blood sugars, especially if they're feeling kind of out of sorts. It's a good tool to know what your sugars are. So now that I've told you all about these complications, our hope is that we can preserve all those organs so you can stay as healthy as possible. And so how do you stay healthy with diabetes? We say keep your ABCs under control. So A is for hemoglobin A1C. You've probably heard of that. That's a marker of blood sugars over 3 months. B is your blood pressure. And C is your cholesterol, in particular your LDL cholesterol, which is the bad cholesterol found in the blood. And so we kind of keep an eye on that, because keeping those 3 things under control really helps protect those vital organs. I do want to say that it's important to our Elderplace healthcare team to understand who you are as an individual and what are your individual goals for your health. We know that food is important to a lot of cultures and communities. We know that everyone is different and everyone is an individual. So our job is to kind of get to know you and your story and what's important to you. And then that allows us to kind of help establish goals that are reasonable for you. So we want to make sure that we're getting to know you, and knowing based on that what I would recommend in terms of your blood pressure or your medications for your diabetes. And Molly will talk about this a little bit more as well. Actually, here's Molly. And Molly, I can advance the slides for you too.
Okay. Sylvia, did you want to share first or? Okay.
Kai ngā tonga koe no mō whanonga mai pē, o nau whia mao whoki ke nau hanga I loi ai tuku ngā kau ke iai. Ko I ngā koe taime ko mao ai koe he suka ka mata ke wesia ho ngahi toto o ngā koho sino. O glawale ki o ngai me toka kovi o ke hange o ke vai tā vai ia ka mata ke ne nefu ho sio. Pea o ku ke toto alma upe o alo tu ofi. Ko I ngā he ko kamatare ke to e wesia ai pea moho kidney. Pea koe nau tamu a ke nau hanga I loi koe ke whai hano malui mo whakahauwhi ke taimi. O kai pē lau e kakao lea pehe prevent is better than cure. Koe tā la ngō ke mamao. Ko I ngā ke whai hano whaka ehi mo whakahauwhi koe mo au. Ko I ngā ke o te tā ke tūnga koe. Tau te whito, when you get older, koe au ke te motu a. O ku kamata rewa pehe to tā pakeri. Kamata re ke motivi ai pē mo tau sino. Ko ia pa koe nau ngai whare I eni hangai mea e tokoni ke mo uile lea kidney. Okay, the question that just came along was asking, what are some of the things that more damaging, throughout the life, was that from diet or, well, I'm trying to translate it, at the same time. Ko kole te peka pau ko e ko ki I whehu ia ko tui pe tonu pe. So they're asking, in a native language, but I think it's, I'm trying to comprehend it. So they're asking, what is the most cause of damaging your body to end up being a diabetic patient? Thank you.
Are they trying to ask in terms of
Like
blood
the
pressure
food.
or
Yeah,
cholesterol or
exactly.
blood sugars?
Yes. They're talking
Yeah.
about like if it's more like from the food that you eat or just the lifestyle that you're doing, or maybe like some people, they're not eating too much, but they're drinking heavily or they're smoking and then just not really exercise. I think that's what.
Yeah. It's hard to tell because everyone is an individual, and we certainly have people who overall eat a pretty healthy diet and stay active and they get diabetes because that's in their genes. So they have a genetic predisposition, meaning they're more likely to get diabetes just because their family has had diabetes.
Right.
So I think in general, we like to just say it's good to have things in moderation, enjoy the foods that you enjoy. If you drink alcohol, drink it in moderation. Make sure your blood pressure is, when you're seeing your provider, is in a relatively good range. Definitely quit smoking. Smoking, we do know, is not good for the body, even in moderation.
Right.
And I think it is like our goal is to get to know people individually and try to work on those risk factors too. So it's a very good question, but a hard one to answer because everyone's a little bit different.
Very good. Okay, this person here is saying thank you so much. You make it very clear that it's about like moderate, things, because the way we eat, we eat a lot of pancake in the morning, pancake before we go to bed, and we eat a lot of sweet pies and other stuff. And
we would like to come to one of your celebrations and enjoy all that delicious food. And yes, I think that for us to say you can never have anything that you enjoy, that's not a realistic thing, but it is in moderation is always the key.
I agree. Thank you. I think what she's trying to say, te whakapoto, whakafuafua. I whonga ho ma mea tokoni. Ko whakafuafua mo whakapoto. Malo. Thank you. you can go ahead, Molly, or whatever you wanted to share.
Okay, I will. So after kind of Dr. Babineau went through some of the, more technical things that can happen when blood sugar is not well controlled, um, I wanted to share a little bit about, that we understand this is one of the more challenging diseases to control. And part of that is because it is about food, and food habits are hard to change. And we, I think across cultures recognize that one of the ways we share our love for each other and our share our welcome for each other is through food. And so we understand that, especially when we're celebrating or when we're seeking the comforts of home, food is really central to that. And so um, we wanted to acknowledge that this is hard. It's not an easy thing to do. If it was easy, you know, we'd all be in a lot better shape. But I recognize, that's true for my family. Certainly when we get together, and we got together frequently, it was all about the food, and it was never a bunch of salads.
Right.
It was rich dishes and our favorite things, and the way we showed each other love. So I think it's something that cultures can relate to, and unfortunately, there are groups that are just more predisposed to having things like diabetes be prevalent in their communities. So go to the next slide. So one of the things that I wanted to talk about is how at Elderplace we kind of approach folks who are trying to manage their diabetes. We, our mission statement is to know me, care for me, and ease my way. So that's something that we try to really live by at Elderplace, and that means getting to know people. As Sarah said, we want to know, what are your goals around health, and what are your goals around your diet management? And I think because we know food is so central to who we are, especially when we're far from home, we don't want to tell people they can't have all of those delicious things. But as Sarah mentioned, it's about figuring out a balance. So we have dietitians. I know you guys met with Joy Gonzalez not that long ago, and she shared some of what her role is. And so we certainly have a huge dependence on our dietitians for a lot of diabetic education for our not only for our participants, but for the folks that are caring for them. How can I provide them foods that they love, and make sure that they're having healthy options, and not overdoing it? So that's something that our dietitians work with. And then being physically active is part of that, and it's challenging as we get older, but we have a great team of therapists, physical therapists, and recreation therapists, and occupational therapists that work with our participants to help preserve strength and function. And so we really, at the center of all of our care plans for any of our folks is who they are as individuals. So that is what I wanted to mention about that. You can go to the next slide. So some of the things that we do, after Sarah went through all of the systems that can be impacted by diabetes that's not well controlled, I wanted to share some of the things that we do for our participants who have diabetes. At every 3 months, because of the impact that what we would call neuropathy can have on people. It can have kind of not just pain in their feet, but numbness, or kind of a feeling of pins and needles, like your foot is just waking up after you've been sleeping on it for a while. That can be a result of many things, but also from diabetes. So every 12 weeks, we try to keep an eye on how that sensation is for people. So we do that at their assessment and their semi-annual assessment. And then they also can get routine foot care. So we have our clinical team who will see people regularly and help trim your nails, check for wounds, and make sure your calluses are protected and things like that. So That's some of what we do. And then also our therapists can provide specialized foot care for those folks who have neuropathy, numbness, or tingling in their feet, to help prevent further damage and keep their feet safe. It's also because of those risks to your eyes, we like people to be seen by our dentist and our optometrist annually. So we make sure your teeth are healthy and your eyes are healthy, and we can identify any problems early on. As a nurse, I didn't put this on here, but as a nurse, I meet frequently with my patients who have diabetes, and either they're keeping track of their blood sugars or somebody is helping them to do that. And we look at, different ways and strategies to help them control it. I've had one of my patients who lives independently. She she has some learning disabilities, but she was able to write, and she kept herself a journal and wrote down everything she ate. And it might be, Sylvia, as you said, that she wrote down, pancakes for breakfast, cookies for lunch, I had spicy chicken at dinner, and I had, a sweet tea. But it was one of my proudest moments, because she kept that journal for several months, and her hemoglobin A1C came down from like a 12 to a 9.2 or something like that. And she wasn't really changing that much, but she was just trying to be more aware. And so that's one of the examples of things that we try to do, is meet people where they are, try to understand kind of what works best for them, and we do the best we can. And so that was one of the fun things that I worked on as a nurse here at Elderplace, that I was really proud of, because she worked hard and I worked hard, and we had a good result. So and then another thing that we also do, in addition to our therapists, our physical therapists, who can help kind of develop reasonable and safe exercise programs to keep you active, because that's one of the things besides medication that can lower your blood sugar, is you get up and you take a walk around the block or something like that, and that's going to lower your blood sugar. Your body can help utilize that sugar more efficiently. So helping to do education about how to stay active is something that we do. And we even offer classes over Zoom, as we've all been more isolated from each other. People can go, we can help provide you with little tablets, and you can join our Zoom exercise programs that are kind of designed for senior folks, and they're really fun and really engaging. So that's some of what we do, aside from like the lab work and all of the other tests and things like that we provide to help kind of monitor your kidneys and your blood sugars over time. So that's some of how we care for our folks with diabetes at Elderplace. And I think the last slide is just sharing our number if you guys are interested in how to contact us. So, but we can open it back up to questions at any time, Sylvia. That's kind of what I had.
So much, yeah, thank you so much. I have a couple people here that they just wrote and said thank you very much. Great information, very inspiring, and it's very motivated. For me to keep myself, um, do the right thing. And because my doctor said I'm on a borderline, so what you're explaining, it's very, very helpful. Thank you so much. Okay, you can continue on.
I think she's at the end of the slides.
Are there any other questions, Sylvia, that you had that we can talk about, or?
Yeah, uh, I have two questions here. One that I just finished, asking that the person was asking, like, what is uh, a healthy natural remedy to help me, because my doctor told me that I'm on a borderline. is there any natural cure for me without taking any pills or any medication right now to protect myself? Because I know that I'm like very overweight, about like 60 pounds overweight. So is there anything to, like, or just moderate everything at this time? Thank you.
Yeah, that's a very good question. I think those borderline folks, we know what a big commitment it is to start taking medication. So whatever we can do to prevent that from tipping over into diabetes is really important. So I appreciate that question. I think, in terms of natural ways to help prevent it from progressing to diabetes, the best thing is healthy diet with the enjoyable foods in moderation and regular exercise. Both of those, even if you lose 5 or 10 pounds, that really does help with your blood sugar management. And it can make people who go from borderline diabetes just to no diabetes. We do keep an eye on folks that have had borderline diabetes, because when you have borderline diabetes, you are more likely to develop diabetes in the future. But the best natural thing you can do for yourself is just trying to have a healthy diet. And I watched your broadcast, Sylvia, with Joy Gonzalez from a couple weeks ago, and she talked about kind of the plate and making sure half of your plate is vegetables, and just trying to cut back. Again, you don't have to say that I'm never going to have another pancake again in the morning, but instead of having 2 pancakes, trying to just have 1 or 1.5. And even small changes like that can really make a difference. So I think that's what I would suggest. There aren't any natural kind of medications that have been proven to help. I think it's mostly just lifestyle and keeping track of what your sugars are doing with regular visits to your provider. Hope that answered your question. Sorry, it was a little rambling.
Yes, and I have some comments here that come along, that said, thanks for the great sharing. And also Jeremy Edmonds. Yes, hi Jeremy. Thank you for sharing this information. Also, Latu Huakau saying information is very vital. So I'm glad, that it's coming along. Also, everybody, hi Alatalo, she's also working with the Asian Pacific Cultural Center. I'm sure Ala will be able to share those great information, with the people in the community, especially the senior. Thank you, everyone. Kalisita Haufano, that's one of our seniors. That is very interesting, with the Providence Elderplace. Fai fikau Israel Fangpo, Tina Tulau, Malo Opito, Maria Soana, Sosaya. Thank you so much. If I missed your name, I'm sorry, I didn't see that. But thank you very much, for coming in. Those everybody said those. Some people just go through the messenger, just text me saying these are great information. And they say, Polo kalama whakaafofa. Yes, Alatalo said yes. Tina Tulau, thank you so much. Nancy Arvidsson, thank you so much. Those are great information everybody needed, especially the lifestyle of the Pacific Islanders, to keep us healthy. Thank you. Yes, you can continue on.
We thank you for all those comments, and I think we hope that, whether or not you come check us out at Providence Elderplace, that you have a relationship with your provider where you can share what's important to you in terms of your culture and your food, and that you can come to some kind of shared goals about your health, because that's what we want, is for you to be healthy and independent as long as possible. And as you age, we especially like folks to be able to stay as independent as possible. So we appreciate all those comments and attention, and we're happy to answer any other questions, but we really appreciate you inviting us here.
Thank you. I just had this really nice, sweet comments here saying, Yes, my client. Yes, I'm going to switch my clients right away before the end of this week, because I really loved, the way you come. If you were explaining it like that to the public, I can imagine how you are treating your patient. And that will be my mom. And I'm happy that you take this time to, to educate us and teach us and give us this great information. It's a blessing to me and my family. Thank you.
That's
Thank
very
you.
kind. I think part of the joy of the work that we do is getting to know people
Yes.
and getting to know who they are, know their families. And so we do feel the honor and the privilege of those roles as well. So thank you for those nice comments.
For sure.
Thank you,
That's what this is
Sarah.
about.
Thank you, Sarah. Thank you, Molly. We do greatly appreciate, and we're looking forward again, for the next program. Thank you again.
Thank you,
Thank
Sylvia.
you.
I hope to meet you in person sometime too. I know Molly got to
I
meet
got
you.
lucky.
But maybe one of these days I'll get to meet you as well. But thank you for all you do. I think it's really wonderful for you to
Yes.
help your community in this way as well. So thank you.
You're very welcome, and we do enjoy it. Even I have the my uncle was there for his appointment. He always said, every time I go to the doctor, they just come over and then this, and poke me, and then they go. This time here, they sit down and ask everything all about me. And now I feel comfortable, and I'm happy to be in the right place.
Oh,
Sounds
good.
loca.
Thank you,
That's really
Sylvia.
great
That's
to
really
hear.
nice. Yeah.
That's nice.
Thank you. Yeah.
Thank you.
Okay, thank you again. You just everybody, thank you. Like we have the team from Providence Elderplace. They were educating. What is the diabetes? Thank you.
Thank you so much.
Have a great day. Thank you.
You too. Have a wonderful evening.
Yes, thank you.
Bye. Thank you.
You're welcome. Enjoy it. We're gonna give you this song here. Providence Elderplace. Ko nau tā mo a koki, ke tau ke a koutou le kere kā, ke nau nofo pe api o mo ui le le iai. Pea ko nau kawe ngā we ia, O nau whai e mea kotoa ke nau whiawhia pia mo mo ulele. Hange ko ia ka pau whi mo ikina ai kupo i whamiri. Lawa peke nau o mai o ave koe ki ho o ngahi appointmenti. O kui kai te ke toi tā ko ia. Nau o si ilo pe nau tolu ai aho kai ho appointmenti. Nau si o pe ki time te pide. Nau whitu taki mai pe o whamanatu mai ho appointmenti i whiha. Pe te maua o atu o peke aku koe. Kai ke ngatai, ke alpe ke whitu pe ta. Kai ke toi hela iha alo kume specialist ke nifo, ke mata, ki he ngahi whakautoa keke. O kun whai katoa pe i he whitu pe e taha. Pea ku iai mo i nau whare whamalo sino. Pea ku iai mo i nau ngahi kakai, ke he ngahi tawha keke. Hange koe suka, hange koe toto maalunga, hange koe tala sisi. Koe haa pe ha whai ngā whakautoa, ka nau whai katoa pea mono whenga i koe. Ke nau hanga o i loi a koe mo whakaiki a ngai mea kou nau ilo e tō koni ai kia te koe ke nofo pe i apia maloloi. Ko ia atu nei tau whai whasi hono wā kua pako e tā rea, pea te tau hoka tuai ke King County Public Health na mo Christina Predict, pe pihe whoki ke tau Siri Kalepo. O atu pe ki whai whasi koni ma aki mo tolu koto pe mo mea mai i he wahao pe. Pea ku ate Polkalamani, Voice of South Pacific and Radio Tonga Seattle, pea me Seattle, Washington, Amerika. Koe Polkalama koe ni King County Public Health, te nau whakaiki ki mai ai, ngai mea ko ia whekau aki, mo tu unga ko ia pea i humu malo i, pea ka pau kia hao whehui, o ata pe ke whakaiki eke mai ia, pea te ma o atu lewa ia i he hiri pe ai whaskoe ni, malo. Ko ia te whamanata te pēne, ango ki mō tolu ko ia ku eke ko ia whekau aki ko ia pa moe talamu ki hono whao. I he aho tōna ki ko ia weekendi, te mauto ki tuku atu ai i he whiawhiko a pongpongi, kai kamata pēa hono whao, pēa alua i pēa i o ao ke wike kahau, ma apoko lelei, pēa tau mai ai pēa i moe container, whafuafua ke tu uta mai ahuanima, e ko whalaite i wike kahau, pēa e whakahekai pēa ai. Ko i ngā koe tau mua, koe aho nima ko ia o maasi, ma wahi atu lewa pe me Seattle, Washington, whawholawa ki Tonga. Ka ko ia ai o ku whakahoko katoa e ngā ui koe ni, koe wha o ko ia mo ngai talamu, whakahoko katoa pe me mana mo i center. Aia koe taha wha noa ni maono. Ta whānoa ni maono o ko e toa sila ia mo whamre more pe. Ko e whitu ia kona o ku iai koe ni ai toa sila koe ni e wha o me iai ai ngai talamu. Ko e taha whānoa ni maono 8th Avenue South, 14056 8th Avenue South, period. I he tawhaaki whakawai site pe ko ia malapa puna. It's only like about a block away me he Des Moines Memorial Drive. Ai au tu a pini I he waha a ko ia o e taha whao no, pea mo e taha whanoa. Ko ia ai te mauto e o atu pe whakaikiki, ka mō kātaki pe. Te maunga rewa o atu ka koe wike kaha u a tā rewa ka mōtolu, te mauto ki talatu pe aho ko ngā ke ngai whai whamiri, ke ngā ke whakafofua ko ngā ke anga ko ia o e whao, ke ua e futolahi iha aho pe tā kai whakawhainga mārie ko ngā ke whakafoi whamiri, pea te mō mai rewa o whao o mō ngahi mea ofa koe mo tokoni ko ia ki tonga, pea kai pe mga tokoni ki awa tai pe ke Koloskula, ke Red Cross. Ko e atu pene tau tai whaskoe ni, e atu tau ki whai whaskoe ni. Maki mō tolu ko toa pe, pea kai e pe mo e whiekau ngā mamahi whakataha mai tau mea whakaeiki I he kolo e malata, ai ako mare ko mai bao tuifua, ko e mea whakaeiki koe ni, whahoko ahono ngahi whai lotu he whiawhini, pea ikai ngatai e lawa I pe o whakakakato, ahono misa, mo e o wau ko ia, I whalotu ko ia o e whalot katolika ko ia, o ki loa ko St. Edwards, o tu ia I he Ocker Street. I he waha a ko ia o e Rainier Avenue, pea mo e Martin Luther King. Ka mata pe whai lotu I he walu pongi auho. Kai o ato ki whai whasko ni, tau ki alu heo kolosi he ke pulavina ka ke whisi, ke mō ki māma whana pe a tari ai pe me hu mai e tau ka whafofonga ko ia, me e King County Public Health, Christina Predick, and also Sili Kalepo. ko e konga hono wani o e tau polokalama, tau kolose ai ke King County Public Health, tau kau whataha whaki hene mo Christina Predict, pai pehe whaki kia tau sili Kalepo. Ko Christina Predict, maha ko e mei lawa ne tau e taha mau whengau e aki mono wahe ai ngahi o ngongo pe mo ngahi whalei ko ia me King County ko ngā to make everybody safe and secure. Welcome, Christina. Christina is a communication specialist, from the King County, and she's always dedicated her time to be with us and share the great information. Hi, Christina. Before we could ask the question that was compiled from the community leaders, I'd like you to please, what is something important that you'd like to share right now before I could hop in and ask the question? Thank you. What's the latest update from the King County Public Health?
Vaccine verification will no longer be required in King County. So this was something that was put into place last fall, and it was never intended to be permanent. It was always meant to be reviewed. And it's been 6 months since the policy was announced. And as of March 1st, vaccine verification will no longer be required in King County to visit bars, restaurants, gyms, or other public events. It does not mean that getting vaccinated is not important. We just know that there's a high level of coverage in the community. Over 90% of people have started their vaccine series. So that's amazing. Businesses might still ask for proof of vaccine, and that's the choice of businesses and different organizations if that's something that they want to do. And that's something that should be respected. But vaccine verification will no longer be required, but it's still very, very important to get your vaccines and to follow mask rules, because this doesn't mean COVID-19 is over. It's just a step we're taking as we move forward.
Because someone just hop in real quick and asking a question because they're listening, but they are Pacific Islander. Ko e whehu I ko pe aia ko ke pehe ko kai ke toi whe mai hoho. So if I could just interpret it in English, so is that true that you're clarifying that the vaccine will no longer be mandate?
You will no longer have to show proof of vaccine.
You're no longer, ko e uhi ngā kai ke toi whe ma uia ke toi hanga o show o si huhu koe pe huhu malu I koe. Okay.
I want to just be clear, the county no longer mandates that, but individual businesses might. So if you go to a restaurant and they have posted proof of vaccine, you still need to show your proof of vaccine to go into that restaurant. But that's choice that businesses are making. It's not King County mandating it.
Okay, yeah, that person said, yes, it's very, very clear. Thank you so much for explaining. Yeah. Thank you so much, Christina. Yes, you can continue on. I have a question here, that was compiled from the community leaders, especially the Pacific Islanders. They asking, why do people still get sick from COVID-19 after they got vaccinated with booster dose?
Yeah, so what we know, so just to remind everybody, this is a new virus and a new vaccine. And we are still learning about the virus as we go, as well as how effective the vaccine is and the vaccine works. And a lot of the conversation at the beginning was that a vaccine will stop the disease.
Right.
And what we've learned is the vaccine is very effective at stopping severe forms of COVID-19 and preventing hospitalization. If you're vaccinated with a booster, you are 92% less likely to be hospitalized if you get sick from COVID, and that's including the Omicron variant. So what the vaccine does, it may not always prevent the infection, but your body is ready to start fighting it right away. So that's the benefit of the vaccine, and it stops the virus in most cases before the virus can start to harm the body.
Right.
So COVID has been seen to affect the blood, the heart, lungs, have neurological symptoms in the brain. And when people are vaccinated, their symptoms are more maybe a sore throat or sneezing or some of these very common immune responses that we see. But you see significantly less of the very severe symptoms that show the virus is hurting the body.
Thank you, Christina. Hange koia na whamatala mai. Ia mo oni pe ke vai pe puke ka koe tau mu a fuke ke ni hanga malui. He whanki o kania ho tau sino, mo whanki elemeni te ko tau sino. O mai vai ia ki hanga he mahaki, pe ko hanga siemu. Ka hoko huhu ke ne malui koe. Okay, so I also have another question here. When will be the mask mandate will remove since some of other states are already required, to remove the mask from indoor gatherings?
Yes, so this afternoon, Governor Jay Inslee announced that for Washington State, mask mandates will be lifted March 21st. And that includes for schools and public places. It does not include public transportation or healthcare and hospital settings. Masks are still required on buses, airplanes, taxis, and in all healthcare facilities. However, in King County, Washington, we are evaluating the numbers and have not made the choice yet or set a date for lifting mask mandates. So it is something that's on the Department of Public Health's mind, and we're evaluating the cases. We're evaluating how hospitals are doing and looking at the data. And when the data shows that unmasking will help, unmasking can be done without increasing the spread of COVID-19, then a similar announcement will be made for King County.
Thank you so much. Hange koia kone ne os whamatala tu, kone na e whai e whakataha, pea o whai lewa ngā oe ki ai, pe te nau toi tuka te pepa moe aho koia whai whakaukau ke to ai tui koia oe mask. Okay, the next question is, how effective is the booster? How effective is the booster? So they're talking about the third dose.
Exactly. The booster is very effective. So let me just bring up a study that was done with Omicron. So it's very recent and very relevant. But a third dose of either Pfizer or Moderna shots reduces the chance of hospitalization by 90% compared to unvaccinated people and reduces the chance of a trip to the emergency room by 82%. So the booster shot provides significant protection against the virus.
Thank you so much. Mo whananga pe ke ne whakamatala mai koe ni, ai mahu inga koia moe ngāwe koia ai booster dose. Okay, the next question is, why lots of people are going through COVID-19 testing now, but not vaccines? I think what is the question is about, they see a lot of people like the drive-through, even going to the doctors or wherever any COVID testing, but not the vaccines anymore. So what makes it, elevate people to go through the COVID-19 testing, swabbing, and vaccine, instead of even they do the home testing instead of the vaccines? Is there any difference now or something to be aware of? I think that's what the
Yeah, I think there's two differences. One is that over 92% of people in King County have started their vaccines. So there's just a lot fewer people that need to be vaccinated than even there was 6 months ago or a year ago. So just fewer people need that. So there's less lines there. But I think the other part of it is with the Omicron variant, the variant is so contagious that it can affect people who have been vaccinated, especially if they're not up to date on their boosters. And so that means more people are getting it than with previous variants. So testing is really important for everything from if you want to see your friends or family, if you have symptoms and are concerned about going into work. And then I think the other thing that's really elevated the number of people who are testing is as things begin to open up and people are very excited to engage in a sense of normalcy again. More people are traveling, and testing is also required for travel. So I think there's a lot of different reasons people are testing now, and a lot less people are getting vaccinated just because so many people have been vaccinated. So that's really great news.
Thank you so much. Yes, absolutely. That is a great news, and we're so happy to hear that, that makes it give us a hope. Hange ko ina ne whamatala mai, ko e ngai whotu peni ko e ngai kulahi whake, ngai mahaki ko hau taimini, pa kua whake kakaia o sivi, neho ko o sihuhu nau tolu, kakaia pa sivi pe ko e sia nau tolu, e mahaki pe kai. So then the next question, it's does the shot protect you from other strains of virus? Ai ko uhinga ko whehu I pe ulava nai ai huhu o malu I ko mea hato e ngahi siemu wa ngai mahaki ke toi hau. Okay. Does the shot protect you from other strains of virus? Thank you.
Yes, so the vaccine has been shown to have really wide protection against different variants. So this vaccine was first used for the Alpha variant, and we've seen that it provides protection against Delta and Omicron and some other lesser known variants that have come in between those. So the protection might vary, but it does provide protection. And this is different than if you're to catch a variant. So what's been shown is if you, for example, if you caught COVID early on, you don't have protection against new variants without the vaccine. But with the vaccine, you have broad protection against variants.
Okay, I want to just take a little quick pause here and just play one of the melodious songs, from the Islands Breeze. And then just only for 1 minute, and then we'll continue on. Ko ia malo opito ho mo kau mai ki he programa, wha malo atu he ni. Ana vita talo malo opito kau mai, male ano tau leva malo opito kau mai, vesinia Fungalei, malo opito kau mai, malo opito mo kau mai me ngai whetu ke. Kuin mahoi kau waka malo opito e kau mai he tau polokalama, wha malo lahi heni, kai ke lava sio kato ko mo ngahi ngoa ka wha malo ate heni. Pakoi ai taimini ate tau ki hiwa koe ni, but we'd like to thank Christina Predict from the King County Public Health Seattle, King County Public Health. Christina Predict has a master's in public health and epidemiology. Ai ko uhinga ia ki he ngai mahaki ko pipi. Malo opito tali malolo fe amoyata malo opito kau mai. Fa malo ten ka ki moto ko tape lotoni. Latu hoa kau, Nancy Avidson, whainga ema taupai, talo fa ala talo, malo opito mo kau mai. Ko ia, make sure you keep sharing this information. It's very relevant. And again, Christina Predict has been working with the Pacific Islanders community for almost a year now. We're so grateful o kia hataha tuku hana taimi ke ne hanga o mai ngahi toko ni mo ngahi aonga mo ngai wharei ki ho tau ka inga I he taimi kotoa pe. Pea o kai ke ngatai, she's the communication specialist, for the King County, Seattle King County Public Health. So this is the Pacific Islands Melody. In about like 30 seconds, we'll be back to our program. Thank you all. We have one of the popular concert, live concert all the time is called Out of Sight 435. Ko e kautaha ko ni ia ko e kau pop singer ia na tame ama peheni ko e whātolu ni ma. Out of Sight whātolu ni ma. Whamalo atu mo kau mai. They said it's a great program and thank you for sharing. We're so glad that you're in the house and joining us. It doesn't matter which part of the world you're on because the pandemic and the COVID-19 is covered worldwide. And even, we're from Seattle, King County Public Health, but what matters, all the information is always relevant and very necessary to share with everyone. Thank you. Thank you, Christina. Thank you again. So I have the next question here. It said, how often do I need to get a booster shot if another virus is coming up? How often do I need to get a booster shot if another virus is coming up? Hangi ko whehu I koe ni, ko whehu ina e toko taha pa mautoki lili whatonga mai pe. Ko kai ke ila pa whatonga pa whaha amoa. Ko e whehu I koe ni ko uhinga. O kutoi whea mao nai ki tau ngawe ake booster shot, o ka pau e to iaha virus is coming up. Okay, thank you, Christina.
Yeah, so right now you only need a booster shot. You receive your normal vaccine series, and then 5 months after you can get a booster shot. And currently there's no evidence that more than one booster provides more protection because 2 shots plus your booster provides very high protection. So in terms of how often, just the once, 5 months after you receive your first vaccine, or if you receive the Johnson & Johnson vaccine 2 months after. In terms of other viruses, that's hard to know. I think if we knew that, we would be better able to prepare. Scientists evaluate different things very closely. I think more than other viruses, it's good to think about other variants and the fact that variants have the chance to be created the more the virus spreads from person to person. So if people aren't vaccinated, if they don't isolate, if people aren't taking precautions such as masking and social distancing, or meeting outside where there's good airflow, there is a higher risk that there can be variants created. But right now, pardon me, We do not know of any variants of concern coming up or additional viruses.
Ko ia hange ko ne ngai fa matala ko e tuku pe fa ko malu I ka e depend be ka tu ko tai mini o ko kai ki te fe ma uia ke fa booster shot I tu ko ia I lolotonga ni. Next question is, if I do all the vaccines requirement, is it going to protect me?
Yes, definitely. Nothing is 100% guarantee, but all the evidence shows that you will be significantly protected if you get all of the vaccines.
Ko ane une whamatala atu io o ki kai ke pehe o ku whakapapau I e lawa I peo malu I koe ka koe mea o ku malu I koe ko I ngā koe tae lango ke mamao. Pea o ku iai koe lau ko pehe, it's better to cure, it's better to prevent than cure.
Exactly.
It's better to prevent than cure. Sayang e whakaehi pea moe malu I ki mua pea ke toki tō ki hamahaki pe mao koe ha whaingata. Aia koe uhinga I tau mua koe oi huhu. Koe tau mua ke malu I koe. Hange pe kone ngai whamatara. Io o whie mao e hoko ia koe malu. Okay, the last question here that I got from the community leaders, they were just asking, is there any other resources to help others in the community during this pandemic? Like what the King County has been done, in the past.
Yeah, I'm gonna see. I'm gonna go to Celie for this question. For what resources are available for people who are having difficulties right now?
Hi, Silly. Talofa.
All right. What resources are available for folks who are having difficulties relative to COVID or just in general?
Yeah, about the COVID. I think it's about both,
Well, a lot of things are phasing down. I would hate to say that. Our care coordination team is actually slowly fading away with their budget and their contract. But I believe the last time you can, ask for resources or services is by the end of this month. I don't know, correct me if I'm wrong, Christina, but the last meeting I was with, care coordination said they were phasing out this month. I know EPRAP has some funding issues as well and is looking towards the state to get more funding, but they're in the same boat, but they will be helping out landlords in the next phase. But we still offer PPEs and yeah, so we still have a lot of those resources available as well. Hopefully that answers the question.
Yes. Yes. Thank you.
I just want to share, you can also go to kingcounty.gov/outreach, OUTREACH. And there are a lot of resources related to things such as health services, energy assistance, an Orca lift card for transportation. So there's different eligibilities for each of them, but that is a good website to go to.
Oh, thank you so much. Yeah, Christina. Yes, our radio engineer is putting it out, the King County outreach. Neta, thank you so much, for putting it out. Remember, this program here is also available on Facebook Live, also in YouTube. You can watch it at any time on your phone, to get all the details and the advice and health protected, about all this vaccine and everything. Hange koe ko whamadala ka siri kalepo, o ke iai pe ai ngahi mea ke tokoni, hange koe ia koe tuunga ko kai koe landlord, hange koe kinau tolu koe ia o whema o tokoni ka pau ke rent. Ka pau ke rent ia api, te ke lava au pito e ni o ngā wea ke whainga maari e koe ni, koe tai mi e ni. Peko ke tatau pia pe ke rent i ha apartment ni, peko whē pia whē tu ke rent ai, ka ke pia ka ho landlord, pia kai mho contract, ke ilo le vai pe are ke county, ke nā totongi, ho reni i he tai whainga taa koe ni. Koe ngahi tokonia o fu whē mau viviri. Okay, this is also like from our group. Well, I think maybe either both of you, we have, they are also working, out there so hard to help having a relief supplies, to send to Tonga that was affected, by the volcanic eruption back in January 15. So they're asking, does the King County have anything like maybe, hand sanitizer, cleaning supplies, wipes, or anything, to ship to the islands, because they're working on it on no later than March 5th, the container will be departing from Seattle. So we got 2 more weeks to go.
King County is very small in the jurisdiction, so
Right.
what the supplies we're given are enough to cover the county. And aid like that would usually come from the federal level. And actually, a lot of what we get in King County has also come from the federal level. So it would be great to check organizations like FEMA or nonprofit organizations that collect supplies. Those would be really good resources. But King County, everything's allocated for people within the county right now.
Oh, thank you so much. I have a person here named David Dupo. He said, thank you so much. I really appreciate, hearing your program. That is very, very helpful. I don't need any help at this time, but I have a lot of relatives here in the King County that I could be able to share this information with them. Thank you. Okay. Whamaloa tēnei ki a ani sia sio whalemaka mo Islandi pupu mo ki motoko koe nei toki huto mui mai o glava peke mo toki whanongo whalelei I he prokalamani I he Facebook pe koe Voice of South Pacific pe ko alu pe ke YouTube o mau katoa ai. He toi o atu ai pe whaku mo whakaiki ki koe hange ko ki nau tolu koe ki he kolo e malata. Ai whakaiki ki koe e te waki ko ia ke wha o ko ia e ngai tara mu ke ave ki Tonga ke tokoni ke ngai family. Pea ko ia e whai rewa whetutaki ke ngai tokoni ko ngai resource ko ni ke ngai ta wha ake ke he ko ngā ke mao ngai tokoni ke ave ko tau kai ngā ki Tonga. Okay, thank you so much, Silly and Christina. I think I have all this question answered, but I will give a little moment here to Silly. Silly, if you have any other resources or any other information that you'd like to share with the Pacific Islanders community. Thank you.
Yeah, no, the only thing I could think of, as Christina mentioned, King County still has PPE supplies to support the county members. If you need those resources for your communities, please connect with Auntie Sylvia or Netta or Sella, and we can provide those resources for any upcoming events or any just fairs or vaccination events you may have. Thank you.
Thank you so much, Sili Kalepo. He is a project monitor, like for the King County Public Health, and we greatly appreciate, both of you. Whawhetai lava, malo au pita polo kalam whaafo'ofa, and then this is very resourceful and very helpful, to share all this great information with our community. So just one last time here, we'd like to have a little melodious song here from the Pacific Islands, and then we'll continue on. If you have anything else, to share before we close. Thank you. Predict, communication specialist, from the Seattle King County Public Health, and also Dalcili Kalepo, he's the project monitor, also from Seattle King County Public Health. So before we finish up, for the day, I'd like to give you both, the chance, like if you have any new announcement or anything that you need to share with the community, that would be this time. Thank you. Go ahead.
I think it's just really important to remember how far the people in King County have come and how far the communities and so much work and effort that has been gone into getting vaccinated and keeping others safe and fighting COVID-19. And we hear a lot about mask mandates being lifted. We know that soon they'll be lifted in Washington, and in King County, they're going to we are considering when to lift them. But COVID-19 cases are still very high. And while they're coming down quickly, it's still important to remember COVID is here and it's important to stay safe, especially if we want to move forward towards normalcy. So I think it's really important to get vaccinated if you're not vaccinated. If it's been 5 months since your vaccine, make sure you get a booster. Still wear masks in public places and just be really smart about when you get together with people, making sure you're not in very crowded spaces, open a window if you're inside. Just taking these small precautions can really help us continue to move forward and to keep COVID-19 away. I think one thing that came to light very recently, as children 5 to 11 are eligible for vaccination, and as COVID continues, we see that these children are vulnerable to infection. There was very unfortunate news of a young girl in Pierce County who passed away from COVID-19 recently. And what we're seeing is that vaccination rates of children in South King County are very low. So we just want everybody to know that your children are eligible to be vaccinated, and you can go to a King County vaccine site, and just like with adults, they are safe and free. And it's a smaller dose. So your children don't receive the full adult dose. It's a smaller dose that has been tested specifically for that age group. And just reminding everybody that that is really important as well, especially not only keeping kids healthy, but making sure they can be around grandparents safely and family, and just giving kids that sense of insurance and normalcy. So yeah, I just want to share that as well in case people don't know about the children's vaccines.
Christina, 5 years to 11. Como
Yeah.
ako pe ki he website ko i King County, o ko nga o fe ma o ia ko e funky ho ko ni fa fa ngo fu ape pe ai pe o vai vai fe unga pe ke ta ni ma ke ta ta ta. Ko nga ke mo nga we aki hange ko time ko mo fe o ia mo si ka to le ke ke o na we se ki na to. That's also protecting the family too, and also the elderly in your family. You know, and it's you can go to that website. Neta, could you please type it up? You know, 5 years to 11. O lava pe ki mau ai whangamari koe ni.
And I think if you're looking to get your vaccine or you're looking for your child to receive their vaccine, there's a lot of resources available. So there's transportation to vaccine sites if needed. If you have young children and you need childcare while you or people in your family are getting vaccinated or recovering side effects, childcare is available. If there's somebody who's not able to leave the home, perhaps they're elderly or they have a disability that makes it very hard to be in public spaces, people can come and do in-home vaccines. So there's a lot of different tools to make sure you can get your vaccine. And those are all at kingcounty.gov/vaccine. You can find a list of what's available and phone numbers to call. But vaccine events like the ones that you host, Sylvia, are amazing. And it's so great to bring it to the community. But if one of those events is not going on, there's a lot of different ways to get to vaccine sites and to get help.
Okay, thank you so much, Christina. Yes, I'm feel like that was a great time to be a part of the vaccines event. I really feel that some of our people that needed it, they come forward and they were so happy. Sometimes they know the vaccines, like at the Safeway, pharmacy, or any other places. But what matters sometimes, you reach out personally because you know those people and make them, to feel comfortable and feel the sense of belonging so that they could come forward. And it's very rewarding, very fulfilling to know that you can help others, and what matters is to help others. And I think that we're going to continue on. I think we set up another vaccine, it's maybe toward the last week of this month or the very first week of March, we'll have another vaccine events coming up. But thank you so much, Christina. Matu aki mau e ngā opito. Ke tau kau pe mo ake hov malui. O fuwhe ma o ke tau ngawe aki. He ko i ngā ko malui pe koe. A koe malui moho ka i ngā malui mo takotake he. Thank you so much, Christina.
Yeah.
Anything else before we close up?
No, I think just thank you for having us, and thank you for all of your work.
Yeah, Tassili, are you still there? Or
Yep, I'm still here.
Tassili, do you have any final words to share before we close up?
No, I think Christina said it all. At the end of the day, I know a lot of folks have COVID fatigue and we're nearing the endemic. It's just, as she had mentioned, just persevere, keep fighting the good fight, and, keep your communities, especially our elders, safe. Thank you.
Thank you both, thank you, Christina Bedick. And again, she's a communication specialist and she has a master's in public health and epidemiology. I go epidemiology ko ngai mahaki pipihia, I have whafonga in my eto tāpani, pia mei he siaro King County Public Health. Ko Sili Kalepo, ko e Hamoa, pa tau whamalo ki ai, ko i ngā kai tau tokotaha. Pea mei he Pacific Islanders Community, o ku hoko ko e Project Monitor, ke tokoni, pa mohono whaka ai, to make everybody, especially our Pacific Islanders community, we want you to please take the vaccine, it's for the protection of all. Thank you all, and we're looking forward to have another vaccine event coming up. O whalahi atu, kwa malo atu heni ke tako tape, malo pito moka mai, tolahe pito ki nau tona I lotoni, ia ku ka taku mōre atu mo ngahi ngoa, ka mawha malo atu heni. Ia moka whataha mo ki mautolu e haoni. Ko ngai polo kalama pe ke tokoni pe lava pe ke moto e whanongo me he kamata ko ngā ke malu e pe ki motolo pe me polo kalama ko ia ai Providence Elderplace ki anga ko ia whaunga whai ehi ko me he mau ko he suka. Okay, thanks again Christina and also Sili Kalepo. Thank you both.
Thank
From
you.
Voice of
Bye.
South Pacific
Bye-bye.
Podcast. Thank you. Bye-bye. Tō whāsoi fua, malo au pito. So we have this. Hey.
Longo tino matangi lele, kutala ua awe maine, etama whanau, o Samoa ua whai mosei. Lota aloa malihero, alo sa ilimalo, ua iloai, o Samoa I omao. Ua pate mama tau toto si toea ina, a ole tina watu tulu ai ua le pisa. Ioko uli uli lo tino, ai mala mala mau o mata tama Samoa, se ia tawhito toala.
Tawa o mai ni ke whaasinga koe e tau polo kalama, whamalo atu heni. Thank you everyone for being a part of our program tonight. And before we're closing, I would like to acknowledge, ai mea whaeiki o ko hoko I he kolo e malata, pea te tau toki whaosi ai pe. Ko e whiawhi koe ni, o ko whahoko whoki e he whamiri tui fua, a e nau whailotu ko I ngā koe nau whaapa-apa, ko I ngā koe tamai o eiki, koe toko oua, koe tamai, ko ne tari lelei a hono ui maonio ni, ke ne whoki ki api, o malo loki ai. Pea koi ai koe amanaki ke whahoko ai ngahi whailotu I he whiawhini, pea whahoko ai pe a hono misa I he whiawhi ko ia a pongpongi. Ka koi ai o ku whai atu pea te kau ngā mama, te kau ngā mama I pea mo e whamiri, ki a mareko, moa I vau tui fua. Ko ne maloloen I hono tau whikngofun manima, pea ko ia o ku o atu pēni e whamiri, e nau te waki, ke whakakakato a hono mea whakaeki, a e nau pōpoaki whakaosi, ke wholau ko ni ai tamai ko ia ko mareko mo I vau tui fua. O ko amanaki ke whakahoko a hono mea whakaeki ai whai a hono misa I he aha ko ia pongpongi. Ka te tuku atu pēne ki whainga maria ko ni. Ke whakahoko a dai e nau si pōpoaki, ka ko e nau whananiri. Mo e nau whakailongai ai mo ui. A mareko mo I vau tui fua. Tapu mo I takawhalo e langi o awhia me loto tatau. Tapu mo eiki kalani walu, mo eitu matupua. Tapu mo tungi mai le fihi. Tapu mo talamalu e whonua. Whare whaa, ngai haa o whatapua. Tapu ke eiki katinari o tai o siso tonga mo niwe. Tapu ke tumu ake o pekia. Api ko pou la lahi. Vai ko utulupe, mai whakalangi o whai. Tulau ke mea wha eiki, o e epa he whakalake pa. Pea tapu, moi whao a mana wha. Ke upaenga he whakatapu kakato o he hauwhanga, ofa ke ata, pea ofa ke ngofua. Ka lafa lalo atu si apasia tua. Ko pōpō uri pea aitawa ngaa, si whangalongonoa mo uturi fuka. Si fuwha ko ane lua, pea mo whakala a, apitupu a koanga ha mo orewa. Watu loko he fua whatongia, si api ko taia lapu mo i kolo kakala, mo i api ko lotolangi. Waka ika, mo whakalangalanga mata moana, ha amea mo i api ko awa, kupolu ke taria e whaingataa. Nei si utaka he nāua o e ofa ke se ofia whakaose e whawhonga e ngahi matala i hei lala. Na nofo lata pe i he kolo e malata, ka rea kina si api ko awa mo i kolo kakala. Ko vare ho mauloto, he tauwha ko tō mawae, ta e whiringaua ko hoko, ko lava kau tatau atu ho mo ao, tuku atu kia malupo mo tongo, ke na whakalato, whakamui manoa e mau whawheta i loto. Ko ia ke kāinga o i tamai kotoa, pia pehe ke kāinga o i whae ai pekia. Mo i whanau, mo i whangamapuna, o talo la kepa tu i fua, levuka e whalame tu pō wheki, mo i whanau, mo i whangamapuna o whane, ana mo ka here tu i fua wheki, whanau mo i whangamapuna o Ameria pa fusifuna ki, whanau mo i whangamapuna o tu i pulotu tō tai o le pō, manu oso tu i fua vehikite mo i whanau a senturi tu i fua, uluamu tu i fua mo i whanau, mo i makapuna o whiriha tu i fua. Ko eni ko te waki ai whakahikeheka o i tamai o whani. Pea e whakakakato ai ngai whatongia a pongi pongi i he whare loto ko ia o St. Edwards, whare loto o Sas Katolika, aia e tataki pe ia e pātere ka piolani kakala. Pea ko ia o mau whakaakua te pe e mau ofa ke kai ngā hono kotoa. Ko i ngā koe whataltalu e ko tuku mai, pea i kai ke toi whai halaunga, ko i hanu, ko i whai pesi lele i taha, ke whakaau ai ofa. Ko ia ko mareko mua i vāu tu i fua, e whakakakato i he whiawhini, ai whakaapa whakaosi, ai whamiri mo, nau ngai whai lotu, kai pehe a tā ke takotoa pe, e apino foanga, o palwawau ka uma a Augustino tu i fua lewa. Pea pehe rewa ki aho a pongpongi, ka mata aho no misa, te mau i whare lotu pe i he walu pongpongi. O a wai ki hongo fulu, pea hoko tai pe aho no misa, pea osko ia whakaha ere ai pe ki he whai toka. Ko ia ko Getsemani, o tuu ia i Pacific Highway i 5. Ko ia, ko tatau atuia ai whamiri hono kotoa, ai whamiri tu i fua, pia ko mau ngā e, whamore more ka pau ki ato whatongia, kai ke kakato, whai pe ho maure rei taha, ki si whai a hono whaka apa, ka mono whalangi ai mo ui, a mareko mua i wau tu i fua, ke toka i nonga mo i whia Maria a Jesu Christo. Mau whia kau whataha atu mo i whamawhalarea ai Voice of South Pacific and Radio Tonga Seattle, ke whamiri i he taimi koe ni oktoa ai mamahi, mo i whaingataa i ho mōloto whare. Whake. whamalo lahi atu heni. Whamalo tēne ke other side whātolo ni ma. Pai whamalo lo ta honga heni. Ta tau pe mo ki motolo ma whahoko ma pe ngai polokalama whafo ofa ke fia ai au tau kai ngā whamaman lahi. Mea whi tūpek nau mea mai. Ko e other side ia whātolo ni ma o whātua ki motolo pia mo tauhi lelei pe. Ko ene o ku tawa o mai ni ke whaosinga ko ia polokalama te whamanatu atai peheni. Pe ia i he komiti ko ia e Seattle Tongan Relief Committee. Te mautok whanonga a pongpongi. Pe ko hai ngai whamiri ke kamata e whao e nau ngai puha. Kamata atu pe i he aho tonaki. O lere atai ki he wike kaha uka kato. Ko i ngā pia haurewa ai container. O whauta rewa. Pea i he wike ki tua. Ko e kamata i ahono aweat ke whakaau atu homo o wha ki tonga ki o mo ngai whamiri. Ko eni na i heni pe ai tokon Palestini, Filipe fot ai katuiwai pa pe he foki ki he tahau kau membi pa e community. Mo e komiti, ai ako mai ko halot puloka i hono whakakakato o e ngahi talamu. Mo no whakama opo. Ai ngā ue ko ene amanaki ke whakahoko ke mau ai mea kotoa pe. Pea ko ina lau professional. Ko e whi ngā ia ke lelei pea whainga maaria ai mea kotoa pe. Whatatau ke anga homo whie mau, ke au ki tonga ho o mou o wha, ke kāinga ko nā wongo sia, pea na e whepaki mo e ngai whainga ta alahi ko ni na i toi tonga. Maha ko tawa o mingi whaasinga polokalama, ta whamalo o pito i he lovely rei a polokalama i he ahoni, na kamata pe ia pe me he Providence, Elderplace, pea hoko atu ai mea e ongo whewhine koe na kakato mai e ai ngai whamatala ke tokoni ke mauha mo i lelei whahawhi koe me he ngahi mahaki koe hangi koe suka mo e toto maalunga. Pea mau ai whoki hokofu wa ai koe kidney ia. Ko ia o hange pe ia koe konga honoa na tau ka whataha whuki ai ngai tānoa malu i ko ia whekau aku mai huhu malu i. Pea me whafofonga ko ia me he King County a Christina Predict me he whoki kia tau Siri Kalepo. Tawa mingi whaosinga, whamalo apito mo mea mai, mo tau lelei pe, o pe tau whelotu aki pe mo whewhia aki, pea maho inga whoki ke mo tau lelei, pea mo mohe ke mauha malolo lelei ka auai whaongosia e sino. Whamalo atu apito, whirimotok whahoa a, kau Silvia Fatima Taimi Aho me he Voice of South Pacific from Seattle, Washington, pe pehe whoki kia neta tua tā pea lava koe mau ensinia ia i he ahoni. Mo mea.